Right, everyone. Thank you for being here. Sylvia, thank you. And welcome everyone. My thanks to all of you who are joining us today. So our webinar today is patient engagement and financial responsibility. And we are gearing our talk towards people who work the front lines of health centers. So one thing that you can do for me right now is to find the chat and let me know your name and what your role is in your health center. And I will get started. Again, thanks so much for being here. All right, so we're from the National Center for Farmworker Health. So for those of you who may not be familiar with NCFH, we're a private nonprofit organization located outside of Austin in Buda, Texas. And our mission is to improve the health of farm worker families. And we do that by providing programs, trainings, and technical assistance and resources. So we just celebrated our 45-year anniversary in 2020, and we're very proud of being able to serve the 174 migrant and community health centers in our network who provide primary care services to agricultural worker families. So I'm seeing a lot of good responses here. Looks like I have people in a number of different roles. It looks like I've got some navigators too. Let me get my video out of my way here. Okay. All right, so our goal with our two webinars, we're gonna have this one today and the next one next Tuesday, is to give you information and strategies that will help you have healthy payment collections. And we'll describe the critical role played by frontline staff in maximizing health center revenue and the many, many opportunities that you guys have for encouraging patient satisfaction at your health center. So we're also going to review specific policies and strategies that optimize patient experience and support the collection of the patient balance, right? And so in addition to discussing specific best practices, we will we'll also offer some patient education tools at the end that you can use. And so this PowerPoint is going to be sent to you in PDF format, and it will have live links to everything that we've embedded here. So don't worry about handouts or anything like that. I'm going to make sure that you get them by sending you the PDF. And also, I just want to say, you know, as we go along, then I'm going to speak pretty generally about best practices. But if you have something that you are doing at your health center that is working well, this is the time to share it in chat, okay, throughout my talk, because this is where we have other health centers gathered together who are going to want to know about your successes. All right, we just have a quick look at who's in the room and get current on the chat. Thank you all so much for communicating that. I see some billing specialists. Great. Okay, so I want to start by defining three terms. So I want to briefly define three terms so that you're going to know what I'm talking about going forward. The terms are patient engagement, patient experience, and patient satisfaction. So patient engagement in health means the actions that a person takes or doesn't take to participate in their care, right? So providers in health centers, they work, you know, doctors and nurses, they work very hard with their health centers on the problem of patients being engaged in their health. So often patient engagement conversations are centered around the patient's active participation in their treatment plan and in their medication management and their preventative care. So hold on just a second. So what I want to talk about is patient engagement as it relates to the work of frontline staff. So the points of engagement that I'm going to be referring to in my talk is routine appointments, you know, follow-up visits, payment of service, payment of bills, social determinants of health screenings, consumer education about the health center, about payment, and following or interacting with the health center on social media, using platforms and portals. And so anything else that you can think of that sounds like a patient engagement that really touches the front line, you can go ahead and put in the chat. All right, so I use the Agency for Healthcare Research and Quality for this particular definition, and it's patient experience. So patient experience encompasses the range of interactions that patients have with the healthcare system. So all of those points of engagement that I just mentioned. And that includes their care from their health plan, working with doctors and nurses and staff at the hospitals, physician practices, healthcare facilities like health centers. So as an integral component of healthcare quality, patient experience includes several aspects of healthcare delivery that patients value very highly when they seek and receive care, such as getting timely appointments, easy access to information, and good communication with healthcare providers, okay? So you can think of the patient experience as both what happens to the patient when they are at your health center, right? Or when they're getting a bill, or when they're cruising around on the internet deciding what they're supposed to do about this particular health condition. But you should always keep in mind that there are several areas of experience that are very highly valued by patients, and you want to get them right. So an example of a patient experience measurement, like when it comes to the quality group, in your health center, would be whether or not a patient has access to their health records, for example. Okay, and then patient satisfaction. Again, I'm using the ahrq.com for this understanding. Patient satisfaction is the difference between what the patient experienced or wanted and what happened. And each patient has a different set of expectations. So it's useful to avoid having a one-size-fits-all approach to patient service, particularly at health centers, because health centers are all about the needs of the patient. So for example, some patients may contact the health center by phone, while a small but growing percentage of your patients may be scheduling or even paying their copays or something through a text platform or a web-based platform, or using the health center's patient portal, okay? So patient experience is the difference between what they expect and what happened. So one of the things that I'd like for you to do for me to put into the chat, and I'll move it up a little bit so I can see it better, is what are your common challenges? So what challenges do you see at your health center when it comes to appointments and payments and patient registration and insurance verification, patient payment, check-in, check-out, that kind of thing? What kind of challenges are coming up for your frontline staff? And you can use your chat to respond. Payment collections, okay, good. If anybody has anything else, we're gonna, today what we're gonna do is we're gonna talk about policies and the kind of the whole health center and how, everything has to work in a certain way so that payment collections are excellent. And then next week, we'll talk about, the payment conversation. Current eligibility, okay. Having correct information in insurance cards. People don't want to do paperwork. They don't have their wallet, no insurance, okay. Patients not always happy to fill out the registration paperwork. Okay, collecting while remaining compassionate and understanding, yeah. Getting the correct address, contact information, good phone number to contact with them. Okay, good. And the time patient support has to do all this. Yeah. So patients not knowing their insurance. Okay. All right. Thank you very much for those responses. Language barriers. Good. Okay, so where do we put our efforts to improve payment collections? I want to look at 4 strategic areas where we can foster good patient experience and healthy collections. And the goal is for each touch point that the patient has with the health center for it to succeed as best as it possibly can, right? And all of the best practices that we're going to recommend today should be happening within a culture where customer service is the priority, right? That the health center practices daily and trains on regularly. So the areas that I want to talk about are the revenue cycle, and I'm not going to go into deep depth about the revenue cycle. We're just going to use it as a model to understand kind of the financial circulation of circulatory system of the health center. And then we want to talk about the importance of frontline staff. These individuals are second only to the providers in the impact that they have on patient satisfaction. And then we want to talk about continuing to improve toward patient-centered customer service. So just as you hone and refine the patient-centered healthcare, you want to try and hone and refine your patient-centered customer service. And then we want to talk about effective patient education. So many different staff areas have this responsibility, and the educational materials that you use need to be developed at the right literacy level, and they need to include materials about the visit and about the payment and so forth. All right, but listen, for those of you who are staff working on the front line and in patient-facing situations, I want to talk for a minute about, the revenue cycle, but I want to kind of make you feel a little bit better that I understand that you don't wake up in the morning going, I am going to optimize revenue this morning. The chief concern for you is how well you're providing customer service and patient care, and how accurately and timely you are completing your task. And that's the right priority for you. So your compassionate, respectful service for patients is your priority, and that's the right priority. But all health center staff need to understand that the health center is also a business. Okay, so health centers have to maintain an adequate cash flow. They've got to get their claims paid timely. They've got to collect patient billings. They've got to collect the patient payment at the time of service. They've got to monitor their collection performance. They've got to establish targets for days in receivables, for example. They've got to monitor their collection rates. And every member of staff that touches on the revenue cycle needs to see how their work contributes to the healthy financial status of the health center. So also, health centers have quite a variety of revenue streams. So they've got Medicaid, Medicare, private insurance, funds from the Section 330 of the Public Health Services Act, other federal funding, funds from state programs, patient self-payment, 340B income, incentives, even rental properties, and more. So it's important for you to remember that the funding entities, such as the Section 330, expect proper financial management. So the wording that I have on the screen is the wording under the billing and collections requirement number 16 of the 19 program requirements of the HRSA Health Center Compliance Manual. So you'll note that it says that the health center must make and continue to make every reasonable effort to collect appropriate reimbursement, and it must make and continue to make every reasonable effort to secure payment for services from patients in accordance with health center fee schedules and the corresponding schedule of discounts. Oh, so I got the chat. Please talk about revenue cycle management in a nutshell. Yes, I will. Okay, so when frontline staff are working diligently to get the patient payment portion collected, they're providing a key service that allows the health center to comply with the requirements of its federal funder. So that's one thing that I want you guys to remember. Okay, so let's do revenue cycle. In a nutshell, we'll visit this picture twice. The revenue cycle is defined, and I think it's perfectly all right for frontline staff to understand that they're working on the revenue cycle. So the revenue cycle is defined as all administrative and clinical functions that contribute to the capture, management, and collection of patient service revenue, okay? So in the most simplistic and basic terms, this is the entire life of the patient account from creation to payment. And you can think of the revenue cycle as starting when the patient books the appointment and ending when the amounts that are left to collect for that visit are zeroed out. They've been received, right? So electronic billing between the health center and third-party payers, managed care programs, Medicare, Medicaid, that's a mainstay of an effective revenue cycle, as is early verification of insurance benefits and coverage, okay? So managing the revenue cycle works hand in hand with the patient flow. And you can see on the screen, you've got to pay, these nodes. And again, this is a simplistic view of the revenue cycle, but you've got the appointments, the patient registration, you've got the check-in, you've got the clinical visit, you've got documenting and coding, you've got the charge processing, closing out the encounter, checkout, patient statements, processing and sending out the statements, and then all of the activities that go with collecting on your reimbursements, collecting on your billings, and managing denied and rejected claims. So, so like I said, managing revenue goes hand in hand with the patient flow. Most of the problems that happen are a function, unfortunately, of the early part of the patient flow. And that is when the health center is collecting all of the information that it needs to submit a clean claim. Okay, so your revenue cycle managers are often going to want to address these problems that are originating on the front end rather than adding them to the problems that they already have to solve on the back end. Okay. So here's an example about what's possible with a great revenue cycle. And, it may not match your health center. It is certainly possible you may be having this kind of success to varying degrees, but this is an example of an optimized revenue cycle. The patient can be scheduled and seen on the same day. The eligibility is checked and the patient copay or the nominal fee is collected before the visit. The provider closes out the encounter at the end of the day. The patient visits are reconciled at the end of the day and sent to billing. Billing goes out the next morning and payment is received in 30 days. And that's obviously an optimal situation. Lots of things have to happen right for that to happen. So the reason why this is considered optimal is because the experience with collections in healthcare is that the further away you get out from the patient visit, the less likely it is that you're going to be able to get collection on that bill. So you want to definitely get the copay and any kind of outstanding balance opportunity that you have. You want to pick that up at the time of the visit. Okay, so let me see some comments if I can. Let me check my time here. Go ahead and if you would please, let me see some comments, your successes or your challenges as far as the revenue cycle and whether or not it impacts your patient experience. Because I'm going to make the case that it's not just about optimizing revenue, it's about optimizing patient experience as well. So if anybody has any comments or on their own revenue cycle or what they know for their own experience, go ahead and put them in the chat. Constant front staff turnover and training. Yes, that's a big problem. That's a big challenge in health centers. Yeah. It's an excellent comment. Many patients dislike being asked to make payment at time of service. They state they pay their bill when they get it. Yeah. Oh, and then they don't. Okay, I gotcha. All right, so let's talk about some of those patient engagement points along the revenue cycle. And I want to kind of make the connection that, you know, that it's great for your revenue cycle managers to sort of understand that patient experience is going hand in hand with this. So appointment, scheduling, patient registration, certification, patient reception and check-in. So getting an appointment soon enough, reschedules, cancellations, filling in the appointment after that cancellation so that, you know, the calendar is still full. Insurance about bringing, information about bringing the health insurance cards and IDs and proof of income. Health centers also need to plan for the enabling services that they provide and the visits such as transportation and translation, accuracy of data entry, verifying insurance, setting the patient responsibility expectation, patients needing welcome and compassion, and patients also needing transparency on the cost of their care, and collecting patient copays and outstanding balances and patient assistance programs and healthcare navigation, payment arrangements, you know, are there options for the patient? And, you know, the health center spends a lot of time on the service delivery that can have a big impact on the revenue that is brought in terms of coding and also in terms of whether or not the patient is having a good experience and will come back. But also, you know, payment consultations prior to having the patient accept the treatment plan, for example, or helping to move the patient to checkout. And, you know, then checkout is an opportunity possibly for payment collection. So those are just a few examples of some touch points that, you know, that are going to happen along the revenue cycle, and that revenue cycle managers really need to keep in their mind, you know, as they're trying to optimize things for collections. So, and you know, on the other side, on the back office side of the revenue cycle, you know, there continues to be touch points. You have billings and collection, communicating with patients. You've got a lot of phone work going on there. So that's very important too. So we have some comments here. Staff feel uncomfortable about asking for payment. Yeah, we need to just keep practicing that. And you know, the payment and collection where you say, especially with high deductibles, collecting the patient portion is becoming more and more and more and more important, because we have high deductible plans and we have more people getting access to insurance because of ACA. And so, you know, there's more of a patient portion to collect. And so it's a bigger lift in terms of patient education and in terms of collection. So there's a challenge of mismatched names, demographics for patients with lots of names, incorrect date of birth on their documents. Yeah, so data accuracy, that's really important. In past the clinic, we found success with being transparent with the patient, okay, and had a minimum amount due if a patient had a deductible like $100. So many patients didn't like it and moved on. Others understood, and it took building trust to provide refunds promptly. Okay, that's pretty neat. All right. So health centers understand that revenue cycle management in terms of optimizing payment collections is, that's basically their priority. But policies and systems and procedures can also protect the patient from poor experience during the visit. So, at the health center level, you want to try and optimize this circulatory system to the best possible to give patients the types of experiences that they need. So you won't have dissatisfaction with the appointments process, with reschedules or with reminders. There won't be a lot of lag time for an available appointment. The wait times in the wait room, won't clog up. Questions and forms and duplicate questions that are put in front of the patient are thought through. Insurance rejections due to claims processing errors, you want to avoid them. That's on the back end of the revenue cycle. Patients not being prepped for assistance and eligibility, lack of documentation, how can that be improved? Confusion about costs or unexpected billings, how can you do everything that you can to inform the patient and have transparency. And then, phone etiquette or the lack of it, or, going into voicemail when there's been a call to the billing office, a call back or something like that. So these are the types of things that we want to, always constantly be working on improving. So some food for thought then is that remember that there are opportunities to improve patient experience as you optimize each piece of your revenue cycle. And then thinking about the moments of engagement at each moment that, the patient is touching something on the patient flow. Is there convenience? Is there flexibility? Does the patient have options? So don't forget those key satisfaction points that we mentioned earlier: timely appointments, good access to information, and that will be information about payment too, not just information about their health care. And then ease of communication with the provider and the ease of communicating with, staff people just like yourself. So training is key. So it should be regular and continual. Staff should understand the revenue cycle as the financial circulatory system and be able to describe how their own job role impacts the revenue cycle. Okay, so for example, if you asked a provider, as a provider, I have an impact on how the patient feels about his care and whether or not he will return for care to the health center. Or I have an impact on the coding and making sure that the documentation of the visit is very accurate, right? Working the front desk, I can give our patients payment options. That helps us with payment collection, and it helps reduce their stress about the cost of care. Or, working in claims, I help get our earned revenue into the health center without delay. All right. So also remember that when you're working on the revenue cycle, that this is a complex system, and a health center, is a complex system. So that means that an impact over on one system is going to touch maybe another. So problems that have a root cause in one part of the revenue cycle are going to end up being something that you have to deal with in front of a customer. Okay, so that takes patience. This is where your willingness to go the extra mile for the customer is very important. And, even if it means just taking the time for a personal communication or a follow-up call, that's going to be very, very important. All right, so let's talk about supporting frontline staff. And then, it's important. Frontline staff has a lot of turnover, and I believe strongly that they really should be people that are being brought into the health center, in the hopes that they will continue their careers with the health center, and that the frontline staff would be, really considered your rock star team because they're so important. So they play a critical role. And let's think about some of the types of supports that frontline staff need. Okay, so support from other areas of the revenue cycle, and often it's billings and collection. Support for the accuracy and ease of use of documenting the patient record. Support for managing traffic through the front area and the wait rooms. They need to understand how healthcare costs are paid so that they can explain that to their customers. They need training in communication skills. We call it assertive communication skills training and practice. And then they need cultural humility training because they're handling patients from diverse backgrounds, and customer skills training and practice, all of this on a regular basis. And usually customer skills training is a whole health center project that, that is something where it's emphasized that everyone in the health center needs to take that training, and preferably together. The frontline staff needs to understand the unique needs of their special and vulnerable populations. And then they need the support to educate their patients. So they'll need, exhibits or infographics and things of that nature. And they'll need to practice explaining something in plain language. So, huddles together and training together to practice those things is important. So they need support with difficult and unruly patients. And we're going to talk about that in the webinar next week, because we're going to talk about speaking with patients next week. And so, training on their tone and their manner and their word choices to keep a conflict from escalating. And these conflicts need to be planned for too. You need to be able to take them offline into another area when they come up. So, and then they also need some autonomy around setting up payment arrangements so that they can get that payment arrangement into the patient's record before they leave the health center. Okay, so key areas for success for frontline staff. This is what the frontline staff are trying to accomplish and do so well. First of all, most important, that welcoming attitude. They bring that friendly professionalism. They are the problem solvers. They bring the look you in the eyes and the smile and the greeting. They have a communication product that they bring to the health center. That is how well they speak on the phone, how well they use the text platforms, how well they email, and how well they speak with someone in person. They have to make sure that their follow-up communications are timely, and they need to keep patients informed about a number of things. They need a lot of accuracy with patient registrations and with insurance verification, with eligibility. So they need to be they have an accuracy product that they need to be very proud of and work on. They need to be experts in privacy and sensitivity and have specific scripts and reasons why they say things a certain way. So because of HIPAA, they need to have very consistent date of service payment collection. So that means that they're making the ask consistently, all right? And then very consistent collection of outstanding balances. Again, so they are consistently asking for those outstanding balances. And, those patients have come into the health center and that they have an appointment, so you can check that in advance. So effective coordination. So the other thing is that's just with their external customers, but, they also have internal customers. So frontline staff have to coordinate and communicate with other staff members. So especially in health centers that have enabling services with financial consultations and navigators and things of that nature. So coordinating how well they handle their internal customers and follow up with them and take care of them is important as well. So those are the points of excellence that the frontline staff is working on, that you are working on. Okay, so First of all, I'd love to hear in the chat what kind of training, each of you that are working on the front line, just looking at where you are right now and how you feel, what kind of training do you think that your health center could provide for you, just like right now, where you are in your career, in your time with your health center? I know from my own experience that that billing and collection staff will often train together with the frontline staff. And there are some, and it works beautifully because they're on each side of the revenue cycle with the most tasks. And in between, you've got the providers who've got to get the coding done. So they work well together when they train together. And I have also seen one group, at least I think, that cross-train. So they will actually work each other's shifts in some cases. So we see, let's see what we have here. I don't have this opened up too long, so I do think my frontline staff could use better understanding of their role in the revenue cycle. Okay, yeah. And so, you have people working on that revenue cycle, and in the back end that can have conversations with them and teach them more about that. Yes. Best way to approach patients with their balances and what is due. I feel weird stating the amount verbally. Okay. And a lot of times with the patient balances, you may want to be ready to actually take those offline. You don't want to be in a position where they're standing up at the front desk, because they may be feeling like somebody else is hearing those balances too. So scripting assistance for how to ask for payment. Good. We're gonna offer that in the second webinar. How to ask for payment at time of service or past balance due when other patients are in the waiting room, right? All right. Okay, thank you for that. Keep moving on here. So I want to talk about continuous improvement toward patient-centered customer service, right? But first, I want us to discuss the social determinants of health before we go forward. So let's make the connection. What are the social determinants of health that are impacting your patient engagement and collection efforts? Okay, so let's make the connection now between your patient's social determinants of health and how well your health center performs in patient satisfaction and engagement and patient collection and payment collection. So addressing the social determinants of health are really woven into your health center mission, and they have been ever since the health center program started in 1965, right? The patient's actual needs are the guide star for the health centers, because their patients have barriers. First of all, they have barriers to accessing healthcare in the first place. And then they have unique needs from providers when they do arrive at the health center. So let's think about this for a moment. Here's some examples that can be felt at the front line. So work hours, childcare, that's going to impact how much time they have for a doctor visit, so if there's a delay, that could be a serious problem for them. Transportation, so migratory and seasonal farm workers, for example, may be dependent on their employers for transportation. So they may have to all come over at once on a migrant night or something like that. Many of your patients have to utilize public transportation or arrange transportation through the health center. There is a story that I've heard, doing this kind of work about a patient that came into a health center and had an appointment, but was not able to arrange transportation. But was I'm sorry, they were not able to be seen at the appointment for some reason, and that was a really bad experience for them. And it was after they had taken 3 different city buses to get to the facility, right? But the end of that story is that the CEO found out about it and intervened and helped that patient. But So another one is going to be health literacy and financial literacy. So you are serving individuals who may not have had health insurance. They need to know about the slide. They need to have it explained to them. They really don't understand how health insurance or health care is paid for. They need to understand just exactly, how the visit is going to go and what they're going to have to pay and when they're going to have to pay it. And, you may have H-2A workers, agricultural workers who need both translation assistance and education about the visit itself, right? And then, language and communication. So you want to be able to work with your patients in their preferred language. And you may have to provide materials that are at the right literacy level. And this is going to impact also your text platforms and your web platforms. And then you want to make sure that you're identifying your special populations because they will have particular needs. Now, hold on just a second. You want to make sure that you identify, for example, migratory and seasonal agricultural workers, whether or not you receive Section 330G funds for them. But at the same time, you need to know who they are among your patient population and know how to serve them. And also, know whether or not you need to go and get those types of migrant funds. So there's one more little thing I want to discuss on migratory and seasonal farm workers, and that is the self-declaration. So HRSA requires health centers to establish policies and procedures to determine a patient's eligibility for the slide fee discount. And that includes acceptable income verification documents. But nevertheless, special populations such as agricultural workers, people experiencing homelessness, and recently settled groups face particular socioeconomic barriers that make it difficult for them to produce the types of income verification documents that health centers typically require for the sliding fee discount applications, okay? So some agricultural workers and day laborers are commonly paid in cash, and sometimes they don't get paid for the work that they do. And it's challenging for them to bring income verification documents such as pay stubs. So various housing arrangements make it impossible for members of these groups to produce documentation of rent and utility expenditures, for example. And or they may be living with extended family, or they may be living on a farm and have that taken out of their pay. So it's difficult for them to provide the documentation around housing or a utility bill. So the self-declaration form is the most practical eligibility tool that the health centers can use to assure the administrative process of determining their eligibility for the sliding fee discount is culturally appropriate and doesn't present a barrier to care. So basically what happens is that you allow them to self-declare, but you will have to go back and give them time to bring you the rest of the documentation for that. And that is something that will have to be audited from time to time to make sure that you're keeping up with that. All right, so let's talk about ongoing improvement to achieve patient-centered customer service. And in terms of the person-to-person customer service, we'll talk more about that in the second webinar. But I'm still again talking, as a whole, as the health center as a whole. So more and more patients are demanding digital engagement, such as apps and patient portals, and health centers are increasingly adopting technology platforms. So The electronic patient engagement means it's an app that integrates with the health center's electronic health record software and practice management software. So here's some of the use cases for digital patient engagement platforms. So one of them is where you have a large population, maybe even thousands of people, and I believe they're called attribution lists, but it's in a managed care program or, Medicaid or Medicare managed care. And the health center has the opportunity to do outreach to those individuals to bring them into the health center. So the digital platforms allow the health center to reach out to, those large numbers via text and email, and then they will get a certain amount of conversion rate and get people into that the health center, so that they don't have to, try and reach all those people by phone. Scheduling, rescheduling, canceling, having an automated wait list is a feature of many of these, and so it'll shop around a cancellation and given a certain protocol to patients that are on a wait list, and do it automatically and fill in the holes in the calendar. There are use cases for disseminating health information. And I know this isn't a health center example, but I know that there is a cardiology example in, is it a cardiology or maybe a diabetes? But the office will, before they have a patient have their first consultation about their diabetic condition, they will send, a video on the messaging platform to that patient so that they can be better prepared with their questions for that visit. And and then social determinants of health screenings are being used on these text and messaging platforms. The messaging platforms themselves support not a lot of room, not a lot of real estate for putting a lot of language on there. So they help you use plain, simple language. They offer secure two-way messaging, which is a very, very prized way for some patients, a growing number of patients, to communicate with providers, and of course it has to be secure. And then they are operating in multiple languages. And, and it's an opportunity for all of those small communications that are so important, such as telling the patient to bring the insurance card, or that there's going to be a copayment, or that there's, going to be a nominal fee or something like that. All right. So why text or message based? First of all, it's not going to be all of your customers preferring text or message based, but the principle is, the best practice is to take your customers' communication preferences into deep consideration, right? And we know that vulnerable populations are increasingly using smartphones and WhatsApp and texting, and that they are less likely to have a computer or an internet at the home. So also, if you think about people working multiple jobs, a lot of your patients have a bunch of jobs. And so it's easier to use texting to communicate with people than it is to work on the phone. Especially with phones that can go on hold. So one thing that you want to remember also with migratory and seasonal farm workers is that they may have little or no internet, or just hotspots at the camps where they live. Some of those camps are actually physically cut off from being able to pick up a signal from a tower. And some of them, have hotspots, particularly since COVID, they've gotten hotspots, but sometimes that will mean that there's intermittent service with that, or when everybody hops on, the bandwidth, kind of goes down. So remember that there may be some issues, with connectivity and that sort of thing out at the farm, and you may still need it to go out and visit the farm. So. Okay, and then notes about online engagement for the health center in general. And the National Association of Community Health Centers has a few resources on this. And if anybody wants them, you can just put it in the chat and I'll figure out who you are and I'll email it to you. But it wasn't really necessary what they have. It's more about patient engagement in general. So I didn't include it in this particular talk, but if you want any resources from NAC on patient engagement, just go ahead and ping me in the comments. And so, but here's a few notes about online engagement. So patients should be able to find the health center on the web and through social media, okay? So, you know, your website is never a one and done thing. You have to commit to ongoing website improvement, and it's not always easy. And you need to commit to improvement in the areas of user experience, how easy it is to navigate around that website, and then accessibility. And by accessibility, I mean everyone can use your website, not just the folks who have full sight, full hearing, and complete mobility, right? And then you want it to be accessible by a phone. So mobile development of your website is going to be critical because you know, many of your patients are using their phone as their #1 computer. And all platforms must be HIPAA compliant, and the health center needs to assess risks associated with communications via social media and establish the necessary controls. All right, I'm going to just check my time. I've got there's two resources here that I won't dwell on, but they are about patient engagement apps. And the apps are listed in the tool inventory. So if any of you have an interest in that, you can go ahead and utilize those links when you get the information. So let's just summarize very quickly. So some best practices that we've been talking about in scheduling and in payment. So scheduling, payment, registration, verification. So patients want to schedule 24/7 via text or in addition to having to call, they want to indicate preferred provider and appointment time. They want timely appointments, effective wait listing, reduction in no-shows, outreach to new patients via multiple channels. They want patients that are easy to make, cash, check, credit card, online payment apps. Patients need to be prepped at scheduling to bring the documentation that they need. And also, you know, they need to be prepped about the importance of communicating with the health center and about reschedules. And so optimizing systems to verify eligibility prior to the office visit, verify benefits prior to the office visit is important. And then, so I'm going to just summarize on payment policy. I want to just talk about the stuff that's very supportive to the front desk. So first of all, you want to establish a health center policy to collect the patient portion at the date of service, okay? And then you want to communicate openly with patients about payment and billing. So open communication, and you really got to help the front desk get over that feeling of hesitancy in terms of talking about the bill. Plan for balanced conversations. You can be ready to divert a balanced conversation away from the front desk to a counselor. You can be ready for these patients with your morning huddles. Offer transparency and information to patients about costs. Always have ongoing staff education. Make sure payment privacy is a priority. Give your patients their options and flexibility with ways to pay, as I said, and allow frontline staff to work with patients on payment arrangement at time of service, and use patient portals and payment arrangements to self-serve on setting up payments to take some of the heat off of, you know, your front desk. Okay, so, and all of this, as I say, in a context of customer service. So if everyone in the health center has drawn together and made a commitment to customer service and begun training on customer service, it's extremely supportive to all of you. So service in health centers is provided to both internal and external customers, as I mentioned. So we've got we've got your patients, but then you've got all of the people that you have to connect with, including your providers and all the people that provide the enabling support. So when staff train together to achieve excellence in customer service, they also improve their relations with one another. And then along those lines, you can adopt written customer service standards and even communication guidelines. And I'm going to bring examples of those in the next one. I have what I call the platinum rule, which is not do unto others as you would have them do unto you. It is find out how others want to be treated and treat them that way. Do your very best to find out how they want to be treated and treat them that way. And so also with your customer service standards and your guidelines, when you are onboarding new employees, they've got their expectations right there up front. So their training starts from day one. And then cultural humility and communication skills training go hand in hand with the customer service training. So those are very strong recommendations for your health centers. Okay, I'm going to talk about, we're gonna wrap up here. We're at 2:30, so I've just got we'll probably end pretty well on time. So let's talk about educating your patients. We said that patients must learn about the world of healthcare, costs and fees and insurance, and your health center's payment policies and procedures. And you need to use plain language and in their preferred language. Okay, so right now a lot of that is Spanish, but there are indigenous languages that are becoming more prevalent. There's Haitian Creole and things of that nature. So your patient education is going to be done by okay, I'm seeing the people want the NAC resources. Thank you. I'll be happy to send those to you. So patient education is something that many different members of staff do. So you may have, maybe using your website, you may be using your web app, you may be using some platform that interfaces already with your practice management system. You may be using social media campaigns, videos, whether they're sent to the customer or they're in the waiting room, outreach campaigns, your community health workers. They are your masters of patient education. They are trusted members of the community. Events, visits, brochures, letters, welcome packets, payment policy and agreements are an opportunity. They're an individual opportunity to do some education. Over the phone when scheduling the appointment, you can chat about what is expected. And then there is all your opportunities in check-in and check out. And I know that the time is short up there, but you want to think about what kinds of things can you have handy to you to help educate your patients as you're going along. So I'm going to go through some resources that NCFH has for you. I think I've got about 4 or 5 slides of that. And then I think we will probably turn off the recording and ask for questions. And then I'll have some additional resources that I'll give to you after that. And I do need for you guys to save time to fill out your evaluation. So this first resource that I have is just the ncfh.org page where all of our health education resources are. We really have a wealth of resources at NCFH. As I said, we've been around for 45 plus years. So we've got a lot of things that you can just browse. And so you can just browse this page and might find something that you need there. I'm going to show you some specific items on these pages that I think are going to be useful to you. So one thing that NCFH does is we do the call for help. And so call for help, I have another slide on it, but the call for help is basically a call line to connect farm workers with health centers. And also we've got some options for helping them get some of their bills paid and things of that nature. And so what I like about this webinar, this is a webinar that you can have a look at. Some of you navigators might be interested, but Elvia shares some of the patient assistance programs that she uses as well. Plus, it'll give you a real good understanding of call for help. So if you ever need to help your patients, okay? So I really like that. Elvia is amazing. No doubt about that. Okay, and then sometimes a patient can be easily confused or misinformed about their financial responsibility when visiting your health center. So NCFH has created a low literacy tool for all migrant and community health centers on their patients' financial responsibility, and then it covers how and what patients should expect to pay, as well as, you know, having an easy to understand infographic on the sliding fee scale. So that's in English and in Spanish. And then, so we've also had, this one looks kind of similar, but it's just on the slide, okay? And so it's available in English, Haitian, and Creole. And this is a customizable, you know, PDF that you can download, and it's a low literacy tool focusing on the slide discount, okay? And then we have digital stories. So we have a whole page full of digital stories about illness, but we also have one that is designed for patients in Spanish about how to get care in their health center, okay? And then we have a new one about the Affordable Care Act. And so we have Spanish and English, you know, a guide to a video that just gives a guide to the Affordable Care Act, which more and more people are, you know, able to have access to now. And then we have fact sheets to go with it. And all of these you can download from either this PowerPoint when I send it to you or from our site. Okay, so let me talk for just a moment about next week. Like I said, we want to talk more about you know, the situations that you get into that feel like tight spots for you, that feel like trouble spots in terms of making the payment, getting payment collection. So that's what we're going to focus on. So we'll talk about customer service and cultural humility, but I'm going to make sure I have a lot of time and resources on speaking to patients, scripts, scenarios, phone etiquettes, and strategies to prepare for people who are upset. So that will be next week at 1:30. That's the 26th. So don't go away yet, because I've got some additional resources for you, and I want to give you an opportunity to ask questions or make comments. But we can turn off, I believe, the recording here, and this is my my contact information for you.